So in the trial, as I said, there was two cohorts, some who didn't receive chemotherapy and some who did. The thing that was unique about the chemotherapy cohort is they were women who needed to recover their ovarian function after they received chemotherapy or to retain it. So they still needed to have ovaries that were producing estrogen after chemotherapy to go on the trial. And they were allowed 8 months after they finished chemotherapy to see if their ovaries would continue to produce estrogen. So that meant that the women in that trial cohort were fairly young. So the median age of the women in the chemotherapy cohort was 40 years of age. So there are a lot of young women in that cohort. And one of the things that we've been interested in is the very young women with estrogen receptor positive breast cancer, so women under 35 years of age, because they've traditionally been a group that have been observed to have a poor outcome for breast cancer with estrogen receptor positive breast cancer. And when we look at the women under 35 who have estrogen receptor positive breast cancer, if they get tamoxifen alone, there's actually a relatively high recurrence rate in the first 5 years. And we're seeing improvements in that recurrence rate if they receive ovarian suppression, either with tamoxifen or with the aromatase inhibitor exemestane. So we feel for those very young women that we can improve their outcomes with ovarian suppression.